possible antimicrobial side effect. First, metradinazole, albendazole, ronidazole, and nimorazole. Side effect of metradinazole. First, neurological disorder, lethargy, weak, yellowish mucous membrane because of hepatotoxicity, hematuria, vomiting, diarrhea, also with neutropenia. Next, albendazole. Albendazole will lead to lethargy, vomiting, diarrhea, convulsion, also bone marrow suppression. Gary.
Okay, ronidazole. The side effects: neurological disorder, weight, lethargy, diarrhea with loss of appetite and nausea. Next is nimorazole. The first one is lethargy, vomiting, diarrhea, hematochezia.
Alright, regarding the pharmacokinetics metronidazoles, about the absorption, and it just effectively in oral because of the bioavailability 90%. And next, the metabolisms of the pharmacokinetics metronidazoles. It is extensive biotransformations in the liver, and 12% remains unchanged, plus water-soluble pigments, and make the leads to stain urine. Alright, so next, distribution of the metronidazole drugs. This kind of drug is lipophilic kinds of drugs. It is actually less than 20% of protein binding, and it is widely distributed in all tissues. And the interesting part is they can cross blood-brain barrier. Alright, and last but not least is the excretions. Alright, the excretion of metronidazole drugs is 75% through urine and 25% through feces. Okay.
Okay, now let's learn about the pharmacodynamics of the metronidazole. First, the metronidazole molecule will enter the cells, and then it will undergo a reduction of nitro group. This reduction will occur under anaerobic conditions and not enzymatically controlled. It will then produce a variety of unstable intermediates, including antimicrobial products. These unstable intermediates will interact with the gel-der DNA, and then it will cause a strand breakage and also damage the helical structure of this DNA. These effects will inhibit the nucleic acid synthesis and causing a cell death. Metrodinazole also causes inhibition of the DNA repair enzyme DNase 1.
Moving on to the interaction of metronidazole with other drugs. The first interaction is with the anaerobic drugs. The interaction will be no interference with the susceptibility of anaerobic bacteria. The second interaction is with the beta-lactam and gentamicin or enrofloxacin. It is commonly used for therapy of bacterial neuropneumonia or peritonitis in horses. The third interaction is with the cimetidine. It will delay elimination and increase serum concentrations of metronidazole. And the last interaction is with the phenobarbital. It will increase the metabolism of metronidazole and decreases the serum concentration.
The overdosing of metronidazole will cause cystitis that will lead to injuries to the bladder wall. This will cause hematuria. The overdosing of metronidazole will cause hepatotoxicity that will lead to accumulation of drugs and cause nephrotoxicity. This will also cause acute kidney failure that will lastly lead to hematuria. The hepatotoxicity will also cause liver failure due to drug-induced and immune-induced, and will cause yellow mucous membrane.
Overdosing of this metronidazole will stimulate the chemoreceptor tergazone and will further stimulate the vomiting center and lead to nausea. When there are nausea, this will lead to vomiting. And the vomiting center will further send the efferent impulses to the abdominal muscles. The salivation center, the cranials, and the respiratory center, which further will exacerbate the vomiting. Overdosing will also kill the gut microflora, which make it susceptible to secondary bacterial infection and will lead to inflammation of the intestinal wall. This will lead to diarrhea. Besides that, they can cross the blood-brain barrier and lead to peripheral neuropathy that will increase the intestinal motility and reduce absorption that will further lead to diarrhea.
Thank you, Sophia. Okay, overdose in metradinazole can increase the side effects such as loss of appetite. This causes the dog to eat less. Getting less nutrient will lead to low in blood glucose level and then will lead to lethargy and weakness. Overdose of metradinazole can also cause the drug to cross the blood-brain barrier. In brain, the drug will bind to neuronal RNA and inhibit the protein synthesis. During the development of nervous system, intra-axonal protein is crucial for neuronal connection. So, if protein synthesis is inhibited, the axon will degenerate. Then the area affected is cerebellar, dentate nuclei, and inferior colliculi, and this will cause neurological disorder.
For the treatment, we can use immediate discontinuation of symptomatic and supplementive care such as fluid therapy is given to replace fluid loss due to diarrhea.
Diazepam therapy. In dogs, the use of oral diazepam therapy is at approximately 0.43 mg per kg, orally every 8 hours for 3 days.